In epidemiology, one of the most important tasks is measuring how common a disease or condition is within a population. Two key measures used to describe disease frequency are prevalence and incidence. These metrics help public health professionals monitor population health, identify emerging problems, and evaluate the impact of interventions. Prevalence measures how common a disease is within a population at a specific point in time. It tells us the proportion of individuals who currently have the condition. Prevalence reflects the overall burden of disease in a community. Because it includes all existing cases, both new and long-standing, it is especially useful for understanding chronic diseases such as diabetes or hypertension. Public health professionals use prevalence to plan health services, allocate resources, and estimate healthcare needs. The formula is simple. Prevalence equals the number of existing cases divided by the total population. While prevalence measures existing cases, incidence focuses only on new cases that develop over a specified time period. Incidence helps us understand disease risk. It tells us how likely individuals in a population are to develop a condition. This makes it particularly valuable for identifying emerging health threats. The incidence proportion is calculated as the number of new cases during a given time period divided by the population at risk at the start of that period. Incidence is widely used in infectious disease surveillance, outbreak investigations, and in estimating the risk of developing disease. Let's walk through how we calculate these two fundamental measures in R. We begin by loading a cleaned NHANES dataset that contains a binary variable called diabetes, where 1 indicates the presence of diabetes and 0 indicates its absence. Prevalence measures the proportion of existing cases in a population at a specific point in time. So we count the number of individuals with diabetes. That becomes our numerator. Then we count the total number of individuals with known diabetes status. That becomes our denominator. We divide cases by the total population to obtain the prevalence proportion. Finally, we multiply by 100 to express it as a percentage. This tells us the overall burden of diabetes in our sample at that time. Let's head over to the output and interpret the results we have there. The prevalence proportion is 0.1768. Because prevalence is a proportion, this means that approximately 0.1768 of the study population has diabetes. To make this easier to interpret, we converted the proportion to a percentage by multiplying by 100. That gives us 17.68%. In practical terms, this means that about 18 out of every 100 individuals in this sample have diabetes at the time of measurement. From a public health perspective, this number represents the burden of disease in the population we are studying. Prevalence helps us understand how widespread diabetes is and informs healthcare planning, resource allocation, and prevention strategies. It is important to remember that this estimate reflects our sample. If we wanted a nationally representative estimate, we would need to apply survey weights. However, for demonstrating the concept of prevalence, this calculation clearly shows how we move from cases and totals to an interpretable population measure. Next, we calculate incidence. Incidence measures the proportion of new cases that develop over a defined period among individuals initially free of disease. For this, we cannot use NHANES because it is cross-sectional. It measures people at one point in time and does not follow them forward. Instead, we use the Framingham dataset, which is derived from a longitudinal cohort study. This design follows participants over time, making it appropriate for calculating incidence. In this dataset, the variable 10-year CHD indicates whether a participant developed coronary heart disease within 10 years of follow-up. because participants were disease-free at baseline. This variable directly captures new cases over time. We count the number of participants who developed coronary heart disease during the 10-year follow-up period. That becomes our numerator. The denominator is the number of participants at risk at baseline. Dividing new cases by the population at risk gives us the incidence proportion. Converting it to a percentage makes the result easier to interpret. Let's head over to the results. This output shows the calculated incidence of coronary heart disease in the Framingham cohort over 10 years. The incidence proportion is 0.152, meaning that about 15.2% of participants who were initially free of coronary heart disease developed the condition during the follow-up period. Expressed as a percentage, this is approximately 15.2%, or roughly 15 out of every 100 individuals at risk at baseline. In public health terms, incidence tells us about new cases over time, which is essential for understanding disease risk and for planning preventive interventions. Unlike prevalence, which reflects the overall burden of disease at a single point, incidence captures the rate at which a population is experiencing new events, helping health authorities identify emerging health threats and prioritize resources. Here, by using the Framingham longitudinal data, we can reliably measure new cases over time, demonstrating how cohort studies allow us to estimate incidence, something cross-sectional surveys like NHANES cannot do directly. We have learned a whole lot in this video. We introduced two fundamental measures in epidemiology, prevalence and incidence. We learned how to calculate these measures in R and how to interpret them to understand disease burden and risk within a population. These concepts form the foundation of public health surveillance and are widely used in research, program planning, and policy development. In the next section of this series, we will begin working with more advanced epidemiologic methods to analyze risk factors and model health outcomes. Be sure to subscribe and continue the series as we build practical, real-world skills for public health data analysis using R.